Justine, would you like to blast us off?
Blast us off. That's fun. A fun Friday afternoon. Well, afternoon for me. Welcome, everyone. As Ben said, this is a little unusual, but we have a wonderful special guest with us, Dr. Anna O'Malley, which I already love her because she's from Minnesota. So that if that tells you anything, it's going to be a great time today. What we've done is really taken some notes from the January 19th call, provided her with some context, and she'll share with us a bit of a presentation, knowing that a lot is unknown right now about the vaccines or how that will shift the world, including retreat centers. So we're going to do that for a little bit. I invite you to ask questions in the chat. Ben and I will be monitoring that. We'll have a little space to explore the presentation. We'll go into breakout rooms, talk amongst ourselves, come back and see what more questions we have. As we were letting everyone in from the waiting room, we were like, this will not be the only time we are meeting to talk about COVID-19 again, or the vaccines or reopening. So as Ben said, we will give you notes, share this recording, and then we'll continue to integrate it into our community call schedule. So with that, Anna, will you please take it away?
Absolutely. Thank you for that. And thanks for inviting me to join you. I'm delighted to be here. And it's true, I'm from Minnesota. Now I'm in Northern California, and I'm very blessed and honored to be in this position of stewarding the Commonweal Garden. So I also have a couple of hats that I wear, one of which is considering how and when and under what circumstances can we bring people back together. I am also an integrative family and community medicine physician, and I work out here in West Marin. So I do direct patient care, and I also do a lot of communication with our community, both locally and more broadly defined around science. And I love explaining science and communicating around science. So yay, science. So my hope is that I'll be able to share what I've gleaned from both the literature and what's happening within our society and communities, and then start to put that into a framework that we can, practically speaking, apply in this beautiful work that we're all doing of bringing people together. And I'm so appreciative of the conversations that you had on January 19th and beyond, and just the thoughtful questions, and also just honoring the expertise that you already have and I know that there's a lot of variation in what you're all doing, as far as if you remained open all along, or you've opened under certain circumstances, or that I know that there's a lot of wisdom and skill already within the group. So I just want to acknowledge that. So I do have a little bit of a presentation, so I'm going to share my screen and just go through a couple of slides. And then, as Justine mentioned, we'll come back and see what sort of questions arose, and then discuss a little bit more. And as Justine acknowledged, a lot of this is emergent and iterative, and there are knowns and unknowns. So, that's in the space too. Fascinating topic. So I'm going to go ahead and share my screen. And can you all see that?
Yes.
All right. Make it bigger. Okay, so that's my name and the couple of roles that I have. And this is what I love to focus on here, is to review what we currently understand about immunizations. And there are two that are currently in application. I've actually received my first dose of one of them. My second dose I'll be getting this afternoon. And there's a third that will probably be authorized for use within the month. So we'll talk more about that. And then how do we use these immunizations in our reopening strategies? And then this is, again, like I mentioned, I know you have a lot of expertise in the public health practices and the best practices as far as like how to keep things clean and safe and all of those good practices, which honestly are going to be with us for quite some time. And then hold the space for reflection. So I like to show this picture because I'm just so in awe of this little being that, well, I don't know, being is generous, but this virus that has just a bunch of proteins and some genetic material that has brought our collective humanity and global community to a halt. And it's to me there. I mean, of course, it's terrible and has been destructive in many ways. And I like just holding the moment with a lot of curiosity around what sort of possibilities emerge when humanity has been put into, from an external force such as this teeny tiny little virus, into a space of reflection and reorganization. So and these spike proteins, are the spike proteins are the place where a lot of genetic variation and mutation is happening, which actually comes into the conversation quite a bit. So we'll just hold that pretty little picture in our mind and with our curiosity. I wanted to start with this because there's a lot that's unknown, a lot that we won't know for some time. But one thing that we can say is that thankfully we are on the backside of our peak. There was things kind of came to a fever pitch sometime around January 6th. A lot going on in our collective society, including the peak of our new cases and mortality. And so we're sliding down. Here we are in beginning of February. So that's great news. And we hope that continues, and we have great reason to believe that it will continue. But like I said, we've got these variants that are going to throw some things into change. So I wanted to just, a lot of words on this slide, but wanted to just reiterate. I know that many of us obsessively read the New York Times and other news outlets. So many of this, this might be a review, but so these are the two immunizations that are currently being administered within our country. So Pfizer and Moderna, they're both very effective. I've received the Moderna one. People are curious, I can describe my experience. Some aches and pains and low-grade fever and a headache just for a day. And then today I'll probably have more symptoms, but that's just a sign that my immune system is working. So this is about as effective as an immunization can be. It is important for us to remember that we really aren't considered protected until 2 weeks after the second dose. And so, and then what does that practically speaking mean? We, the person who received the immunization, are protected from serious illness. But what we don't know is whether we still could be in an asymptomatic way infected after we've had the immunization, and whether or not we could transmit it. And so that is really that's the crux of the matter right now. And that's what science is working very hard to figure out. But that little caveat of unknown, whether this immunization, as powerfully effective as it is, and as important as it is in creating herd immunity, supporting our supposed, the so-called herd immunity, it will be effective at that. But we don't know if we will be able to still transmit it. And that really has a lot of relevance as we consider reopening. One other thing that people are really curious about is, as we have these variants, that arose in the UK and in South Africa and in California, we're very curious about whether or not these immunizations will still be effective. And the signs are that it remains moderately effective. And again, efficacy that's a kind of a loaded word in the science. Efficacy means, did you get the infection in a symptomatic way or not? But what we can say is that even if people still got the infection, perhaps at a higher rate than they did before the mutation or for the non-mutated virus, they were still protected from serious mortality, morbidity and mortality. So that is great news. And boosters are under development, of course, but what really I think is the take-home message regarding mutations is that from a public health perspective, there's a fierce urgency in getting as many people immunized as quickly as possible so that the virus can't do what it is programmed to do, which is replicate and replicate and replicate in person after person, and then have mutations arise that give it a competitive advantage. We want to disrupt that capacity, which is why the public health, all of those public health considerations like mask wearing and social distancing and all that, it remains very important, as does hopefully a rapidly increased rate of immunization. Okay, so I'm not sure how much of this people are wanting to review. I certainly, if people want to know about the science of how these mRNA immunizations work, I've given talks on this in our community because a lot of people, of course, are curious. What is this novel technology that I'm going to be accepting into my body? We can talk a little bit about who is reluctant, what the current rates of reluctance are, or what the ambivalence is about. So this is the mRNA virus vaccine technology. And so here, this is the little delivery technology, which is basically a lipid nanoparticle. So this circle right here is basically like lipids and cholesterol, very much like our own cell membrane. Our cell membranes, our little cells inside of our bodies, are made up of cholesterol and lipids. And so in order to get something into the cell where the action is that we want our body to engage in, we have to both protect the particle that we're delivering and get it to merge with our cell so it can deliver it. So it's newish technology. It's been around for a few years, this particular part, the lipid part. It's used in cancer therapy. The mRNA technology has also been around for several years. One of the reasons we've been able to do this so quickly is because this has been being studied with other virus vaccines since 2003 or so. So that's part of the concern is, wow, how do we get through this, push through so quickly? What does that mean? There were some partisan conversations around the time of the election that also made people feel a little bit nervous about it. But my read of the science, the process, understanding some of this science is that this is, the safety data that we have thus far and the experience that we've had with it over a couple of years gives me reason to certainly trust for my own body to receive this and to feel good about encouraging other people to take it in. Now, the other concern that many people have is that this is genomic material, right? So this is mRNA. So this little snippet of material that's being delivered to the cell is giving, it's basically the instructions for us to make, our bodies to make the spike protein that the virus has, so that will create antibodies against that. Many people are concerned about this possibly interacting with our DNA. This particular vaccine technology, the mRNA, which is Moderna and Pfizer's immunization, it doesn't go to the part of the body where our DNA is. It stays out here. This is where our DNA is, down here in the nucleus. It stays out here. So there's no capacity for this to interact with our DNA. This is not at all like some of the technology that we have in our food supply that a lot of people are worried about. It's not at all anywhere like that. And I'd be happy to answer any questions that people have about this, because really I think as far as our collective strategy for returning to some sort of new normal, it's important for us to understand it and also to hold space for people who have concerns and questions. And there are a lot of theories out there and a lot of concerns about whether or not this is kind of like being microchipped and surveilled, and what's really going on, and from a deep state, but there are a lot of interesting theories out there, and they've been debunked, but it's important, for us to just hold space for that so that we can be respectful. And I know that this is part of, the all of us are trained in and drawn toward holding space around complexity. And there's a lot of complexity and variability in what people are willing to take and put into their body. And that's really central to our conversation. So we can talk more about that. This is my dear daughter, Elsa, being throat swabbed. We had in Bolinas, we had a big testing effort that happened back in April, which was an interesting experience to go through. And the point of what I'd like to make here is that the immunizations, hopefully we have widespread acceptance of immunizations within our country and communities. That's how we'll effectively get to herd immunity. But until we get to herd immunity, immunizations are not considered enough to be considered protected in the collective space. So what am I trying to say? So right now there's a lot of focus in the travel industry, and I think this is really instructive for us to look at what's happening with airlines, what the guidelines are around, both like coming down now from the federal level and from industry, because people in an airplane, it's kind of like being on a retreat for 8 hours or 4 hours or whatever. We're going into this shared space. It's a smaller space than our retreat halls, and or maybe it's akin to being on in a yurt, but it's a small space. And so it's important for us to not be infected when we go into, of course, we want to be screening and doing all of the public health things, knowing who's on board. But an immunization at this point is not being considered adequate for entry into a plane. And the reason is we just don't know enough about immunizations to say for sure that we're not infected. And so because of that caveat that I mentioned before about immunizations, we just don't know enough yet. So testing remains really important for travel. So this undoubtedly is going to shift as we understand a little bit more about what happens for immunized people. Let's see here. So again, and this is, I think, relevant, especially as we consider reopening, and if we're going to be requesting or requiring. I think there's someone who's unmuted. If you could mute that just for ease of listening, thank you. That we can talk about whether, some people will be requiring immunizations, just like traveling to a country where yellow fever is endemic. You have to make sure that you've been immunized, and you have to show your card. That's part of what's considered global civic responsibility. Going from one place to another, you have to prove that you've been immunized. And so that's probably going to be coming. But until that happens, and that's like on a global societal level. But for us within the retreat center realm, we can talk about, like, do we want to encourage everyone to be immunized? Of course, some people can't be immunized. It seems that the number of people who really truly can't be immunized, it comes down to those people who are allergic to the components, but people who have autoimmune conditions, there's some special considerations, and I'm really happy to answer any questions that people have about that too. But for those people who really can't be immunized, we want to be able to create a safe space around them and to protect them. And so testing is probably going to be part of the equation, down the road or at present. And the good news is there are increasingly available rapid tests that, there's home tests that are now being licensed, and the problem is that they're not perfect. And so it's likely that we're still going to continue to need to be doing like the masking and the separation and all of the public health things that we're doing for quite some time. That said, let's see here. There's a lot of conversation around when can we take the masks off? When can we, just dispense? When are we safe to dispense with all of those precautions? And that's one of those unknowns. If two people are together and they've both been immunized completely, and it's been 2 weeks since their second dose, or in the case of the Johnson and Johnson, it's a single dose one, which is great. If two people or a group of people, if everyone has been immunized, it's very likely to be quite safe. We can't say with 100% certainty because we know that the immunizations are only 95% effective, and that's like within the whole group. We don't know if they're exact, but they're effective enough that we can say within that setting of completely immunized people, the risk of any of them becoming very, very ill is extremely low. So that's great news. But if we bring a bunch of, say we have a retreat of 20 people, everyone's immunized, they're all together, we feel good about masks coming off. What we don't know is if someone is asymptomatically carrying the virus and then we transmit it to someone else, and they are protected from serious illness, then what happens when we go back to our communities if everyone else is not immunized, So this is kind of the delicate dance that we're going to be doing for a while, is really being thoughtful around, okay, we're protected, we're not going to end up in the ICU or dying from COVID, thank goodness. But when we get back on an airplane or go back to our communities, are we unwittingly transferring the virus? So that's part of the consideration. So there's a lot of conversation now around an immunization passport. I actually have this little piece of paper in my wallet that will be recording my second dose today. It's a piece of paper. But the conversation, and I think probably where we'll be going in the not too distant future, hopefully in a really transparent, equitable, organized, perhaps all of that's unrealistic, but in some fashion, there is going to be some sort of a digital passport. And you could imagine if you're going to an airport and trying to get on an airplane, and the requirement has evolved to everyone on the airplane has to be immunized. What they're trying to avoid is some people pulling out scraps of paper, or some people, having this app or that app, or this digital interface, so that if there was some sort of unified digital way of recording whether or not we've been immunized, then that would facilitate travel and gathering and going to concerts and all of these sorts of things. This brings up a lot of concern for a lot of people. And so, we'll need to be holding space around that too. It's probably a while off, but this is kind of where, this is how the conspiracy theories of Bill Gates wanting to track us and somehow tie us into Bitcoin and like the whole, there are a lot of conspiracy, a lot of the theories that are out there are sourcing from very practical, real realities of needing to track what someone has or has not had. But just to say, there is no way with the immunization for someone to like hold your hand up under a magic light and see whether or not you've been immunized, or like it's not going to. There's like a lot of interesting theories, but basically it's going to come down to having a digital record of whether or not you were immunized. And this is akin to, what we already do for kids who are going to school, and their immunization record, and travel to places with malaria and yellow fever. But it's it's going to be digitized and global. And of course, there are equity issues, trust issues. So it's going to have to be done really well in a transparent fashion for people to accept it. So, a lot of things that were just raised in that. And of course, there are more considerations that many of them, have a lot of justice issues, equity issues, this immunization supply and distribution. Before we hopped on the call, Ben and Justine and I were talking a little bit about this, that it's so important for us to be thinking about who has access to immunization. So, we could have a conversation about globally. My goodness, we in the United States have privilege upon privilege upon privilege heaped upon us. Many places will not be receiving immunizations for a long time. In the global South and in Africa, there are so many disparities. So I think that's important to just name that. We here in the United States have a lot of privilege around that. And then, and we're certainly seeing this on a local level, the supply is very minimal. So here in our community, we have a lot of elders. We have a large percentage of our population who are above 75 and 65. And so, and people really want it. Now, it's not the same everywhere, and we'll talk a little bit about that too. So here, depending on how savvy, it really does seem to be correlated with how savvy and proactive and even aggressive people are, whether or not they've already received the immunization. Of course, healthcare workers and in-home caregivers and people within health and essential workers are being prioritized. But within just the 75 and up, it really does fall along the lines of privilege when it's just like left to people's own abilities. So, and locally, there's been a strong effort to prioritize people who are underserved, uninsured, on Medi-Cal, which is our equivalent of Medicaid, excuse me. So there's effort around that, but when there are mass immunization efforts that are located in places with underserved populations, what is being discovered is that affluent white people figure it out and find out how to get there and get to the front of the line. So I think one of the most important equity issues is how do we make sure that we within healthcare, we're running lists of our patients and reaching out to those people who are 75 and older, but also, with health conditions, but first and foremost, people who have socioeconomic and racial disparities. So that's incumbent upon us, and I think important for us to be thinking about it when we're putting on the important lens of justice and equity. And as far as the immunizations, the concerns and the fears around them, there are many intersectionalities between partisan politics, proactive health informed individuals, and what's interesting, I came across, and I'll share a link if you're interested, a recent poll that looked at how the lines of vaccine acceptance are drawn. Is it of course, like early on, the conversation has been that people of color have been long abused by the medical industry and medical world, and there are great horrors that have happened, and so it's really important for us to be sensitive around how we're approaching this conversation and being really responsive to concerns and understanding it within this larger context. Interestingly, some of the polls that I've read, and one that was just published on the 3rd, showed that it's far more likely that partisan politics will predict whether or not a person is open to receiving the immunization. Currently, about 50% of our country is interested in getting the immunization as soon as possible. Within people who identify as Democrat, it's about 72%, independents 51%, and people who vote Republican 39%. But then within those partisan demographics, it's actually pretty equal between white people and people of color, which I find really interesting. So, that's we don't want to make any assumptions about our retreat participant politics, of course, but it is interesting to just think about what that means for us. And as I've mentioned, we're even if we're immunized out in society, we are going to have to continue to wear masks and keep ourselves distanced until we reach herd or community immunity, which I like. I like using community immunity a little bit more than herd. We are not cattle. But like, as I mentioned, if we are able to come together in a space where everyone is immunized, then with caveats, we could consider taking the masks off. But again, lots of unknowns there. So, and then we mentioned a little bit the variants. The question about when will we be reaching community immunity is a really interesting and relevant one. And Dr. Fauci has come out saying that he thinks that by perhaps fall of 2021, we might get there. But the rate, the percentage of people who need to be immune, that's what we're talking about as far as like our herd immunity. For it to be protective, it really depends on how contagious or transmissible a virus is. So for measles, for example, we need to have 95% herd immunity, 95% immunity in order to prevent transmissibility because it's just super contagious. COVID is not as contagious as that, but there is concern that as we have these mutations, these variants that seem to be more transmissible, not that much more fatal, but much more transmissible, that our community immunity rates might have to be higher in order to reach that threshold, probably somewhere between 80 and 85%. So that, of course, that pushes the timeline back, and of course the number of people who accept it and how we're messaging around that and holding space for the complexity, but still presenting the science and encouraging people is going to be really important. Okay, and I think, yeah, I saw that there are a number of questions about how do we hold the space in a way that protects confidentiality, and what are guidelines regarding that. And I wanted to include this link here that the CDC has a lot of really great resources out there. You're probably aware, guidelines that they're updating continually around event gatherings. They are to supplement our state and local public health organization guidelines. So, that's the place to go first. But there is a good link here for the ADA considerations in a pandemic. And basically, it just comes down to, we really need to continue to protect people's confidentiality. We do not ask, as we're doing our screening, apropos fevers and symptoms and creating safe structures for people, we need to make sure that we're not asking about their underlying health conditions that may make them more susceptible to the virus. That's true, they may be more susceptible, but it's really nothing that we can be asking about. So there's a lot of really interesting information there. There's the link for the poll that just came out, and there's a lot that I didn't put on the slides. I'm going to stop sharing my screen here and come back. So yeah, I know that there's a lot of uncertainty and a lot of things that we just truly don't know yet, but it's, the science is evolving rapidly. Every single aspect of this is being looked at really carefully and quickly. So yeah, I'm curious what this brings up for people, and if there are any questions on anything that I mentioned, or any other things that have come up.
Well, people kind of wrap their minds around that. I just wanted to say thank you. We had also talked about making the science accessible, and I'm grateful you walked us through many components of that and answered some of the questions that were lingering from the 19th. And a lot of it was about community unity. I'll start using that language, and really what that means for reopening our spaces from just gathering in general. Many of us have people who travel across North America to the retreat center spaces, not just very localized, and what that may mean for shared bathrooms or food or just being together without masks. Um, if I invite people to populate the chat or unmute yourselves and ask questions, we have a bit of time with her.
I'd like to just jump in on that point. I think that the traveling from one place to another, there are concerns around that. And so I think the more, if as people start to do that, I think it will be really important for us to for people to be very thoughtful around the lead up to getting on that airplane. So if people are going to be traveling to a retreat center, say they've been immunized and they're coming from one region going to another, it will be really important for them to take extra precautions, not be exposing themselves to people, not being in groups, continuing to wear masks, et cetera, distancing before they get on the airplane, taking a test, as the airlines are requiring. That's really helpful. And so even if they've been immunized, get that negative test, make sure that you're not carrying something, reduce the amount of exposure leading up to getting on the airplane. And then, being at the retreat center, I think it will be interesting, to see what sort of recommendations evolve around testing for people who have been immunized. We don't have clear guidelines around that right now, but no doubt they'll be coming as we have more understanding of exactly the degree of protection and the reduction in transmissibility once people are immunized. I know that there are some questions around whether or not it's okay to be doing buffet style. Like it was some just nuts and bolts practical considerations, and the guidelines still do require a lot of caution around what happens in dining halls and being in shared spaces when the masks are coming off for eating. So, the buffets are considered still risky, not because it can be transmitted through food, but just because of touching the utensils, and so plating of food is still considered the best practice. Let's see here. Shall I just go ahead and read things in the chat, or would you like to? Yeah, okay. So here's a question. With the new variants coming into play, what wisdom would you want to share about people gathering, even masked, distanced, and in small groups for longer, over an hour periods of time for a talk or a session? Yeah, I mean, truly, it's to be erring on the side of caution. Because these variants are more transmissible. There are now guidelines coming out around wearing 2 masks. I think one question I'm curious about in here is, are these for people? It's going to be a long time, probably many, many months before we are anywhere close to having a number of people in a shared space that are immunized. So until that happens, the caution is to be very, really being very careful when bringing people together. So and the variants, of course, just heighten that. So our local public health guidelines and within the CDC, it's still to keep the number of people that are gathered small, and the risk goes up whenever we're in a shared space indoors for over 15 minutes together, certainly within 6 feet, but even in an indoor space, we want to make sure that we're paying attention to having good ventilation, windows open whenever that's possible. And you know, I am really advocating a lot of caution until we get to the place where a number of people are immunized. Many of the older centers have facilities that offer double rooms. Are single rooms a must for months, years? I think really this comes down to, are people immunized? You know, if people are immunized or have been tested and they have negative tests going into this situation, I think that's, you know, a much lower risk. I wish that I could cite some guidelines that were specific to that situation, but again, I think as we have more and more people who are immunized, um, that, you know, those sorts of circumstances are going to become much less risky for the people who are on retreat. Again, the consideration is, after we leave the retreat and go back to our usual circumstances, we have to be really cautious around reintegration in case we had some sort of an exposure. I hope that answered that question. So basically, I don't think that single rooms are going to be a must for months to years, but the caveat is, you know, if people are immunized and protected.
Hey, Anna, I have more of a comment or just something to share rather than a question, but
Wonderful.
our retreat center, you know, one of our parts of our twin mission is to offer our grounds and our services and retreats for caregivers. And so currently we're really focusing on the healthcare the first responders, the healthcare workers who've been completely depleted by this virus. And yeah, you mentioned it briefly earlier, but I just wanted to kind of underscore it, that it's complicated for us because being in the Catskills in a rural area where the virus really hasn't touched much at all, we're thinking of our community because we can bring up first responders who've maybe all been immunized and it's been 2 weeks, but our staff hasn't, and maybe we're masked, but we're inviting these people from places like New York City that have been really hard hit from the virus, where there's so much stress, and we're just worried about, you know, that spreading to our community if things are being the virus is being passed asymptomatically within that group. So it's created a lot of questions for us, and we really don't know how to move forward because we want to protect our community, but we also want to offer our services to these people who are just so emotionally depleted and in need of renewal. So thank you.
Thank you for bringing that up. And I think that speaks to the importance of when people are coming together, and, you know, hopefully a lot of these people have already been able to be immunized. Although I just heard just recently a very sad story about someone who's well, there are many healthcare workers who are not immunized yet. But assuming that these people have been able to be immunized, it is important for them to stay on site and to not be, you know, going out and going grocery shopping or, you know, mingling out in the community because of that, which you just mentioned. Like, it's we do really want to be thoughtful around the way we're engaging with community, and hopefully they're, you know, as they're traveling there and going about, you know, still wearing masks. But to protect staff, I mean, that is a really important consideration. And so there's a lot of plausibility around, if someone has been immunized and is not symptomatic, it's very plausible that there's not a lot of viral shedding, there's not a lot of coughing or sneezing, so that, you know, is it likely that there are a lot of, you know, aerosolized viral particles in an indoor space where these people are gathered if they've been immunized? Probably not. And if the staff members have their own, you know, masks, hopefully really great masks, you know, KN95 masks are K95 masks are really pretty great and more readily accessible than N95s. So, you know, I think it is really important to be considering how to protect staff and using all of, like, the distancing and the ventilation and wearing of the masks and hand washing and disinfecting surfaces and all of those precautions are really remain important for protection of staff and the community around you. Thank you for that. And thank you for doing that work.
I have, I don't know if it's a question or a comment, but, you know, retreat centers, we're kind of known for pausing. You know, we preach that quite a bit, like pause and take time to, you know, take time to stop, so that reflection and that, so that new insights come through. So this has certainly been that holy pause, I think, that we have been forced to take. Yet, you know, what I hear you say, when you say the word caution, for example, open up with caution or travel with caution, I'm just like, your definition of with caution may be so very different than what many of us who are not in this field define that to be. So I'm hearing that vocabulary and I'm thinking about the pause and wondering what 6 months time, when hopefully with an invitation to come back to a community call, what is the conversation going to be like? When I hear your words right now, I still tremble a little bit of opening. Is that really possible right now? Do we want to take that risk? Would I be very cautious in doing that in your definition with these wonderful masks that you talk about? You know, we have masks that sisters have made and they're beautiful, yet, you know, so those things, I think that when I hear you say that, I'm thinking, I wonder in 6 months' time, what are you going to be saying to us, or whoever comes to talk to us? What's that going to look like? Yeah, so.
Yeah, thank you for saying that. I mean, I feel this dynamic tension within myself, you know, like constantly on a daily basis, but certainly as we've gone through this, like the desire to just relax and not be, because like part of caution, like fear creeps in, you know, and it's like how are we holding the challenge of the unknown and this presence that moves in an unseen way through us and, you know, can cause death. You know, that is a very real and understandably fear-provoking situation. And we don't want to be cavalier about that, nor do we want to be coming from a place of fear. And so when I think about, you know, I all of this comes down to, you know, statistical probability and whether or not we, like how we hold it, and also like what sort of spaces we have, you know. So I think that for me in the Commonweal Garden, we have felt really comfortable with doing things outdoors and gathering people with, you know, like bringing people in cohorts of 10 to 20 with lots of space outdoors. You know, we're in Northern California, we can do that. We've kind of, as we've moved into the peak of transmission and rates of illness, we've really even paused on that because it didn't fit. And plus, like over the holidays, we had people who were living in the garden who were exposed, and we were just like on this rolling quarantine situation. So we didn't really even feel like we could responsibly be doing anything more than just sitting tight, even though we're in nature outdoor and have like all the outdoor space. But much of the work of bringing people together on program in our garden, it is in a yurt, you know, a 30-foot yurt. And so for us, there's just like, we've gone to the virtual space just because there's really no way to bring a circle of people together in a yurt safely for a period of a day, so or two. And even if we brought it down to like a third of capacity and had 6 feet apart, we wouldn't have enough people, practically speaking, in order to make the numbers work and like logistically to be able to afford to do it. So we've just kind of surrendered into hopefully creating contingency plans around the fall. And so that's practically speaking how we're holding caution. And it's true. Like I feel when I use that word, I recognize that, you know, everything that I say has the weight of coming from a medical professional and a community medical professional. And so people hold it with the gravitas as like, here's public health recommendations being reiterated or underscored. And so, so I have this, I really appreciate you bringing it up, because there is an energetic, it's not my preferred energetic for holding space, you know, of caution, you know, the precautionary principle, or, you know, even though so I think, but it is incumbent upon us as people who want to hold space in a way that makes people feel relaxed and secure and safe, that we hold in our heart caution so that we can be relaxed around authentically bringing people together and feel secure in doing that. And so truthfully, like the like radically honest truth is that given the amount of uncertainty that we have with immunizations and the increase in transmissible variants, that the most cautious thing would be to hold off until we have herd immunity and a quorum of immunized individuals around bringing people together. So that's, I mean, that's the truth that no one wants to hear. And that is like the most cautious thing to do, that confers the ability to be completely relaxed around being in a shared space with each other. The flip side of that is those of us who, you know, are blessed to have the space and weather that allows for outdoor and, you know, opening the windows and like you're not going to freeze, to have good ventilation. You know, there's still things that we can do, but to truly feel relaxed in being safe, it's good to be patient and cautious. Here's a question. Yeah.
Thank you. Thank you.
Margarita, this is Tom. I so much appreciate what you said, but I also would like to offer the word precautions. So if we apply every layer of precaution that is available to us, then our staff and our guests could be relaxed. For example, if your current state is 10 or less, can you do most of your things outdoors? Can you lodge every person separately? Can you require a 14-day pre-health screening and a test prior to them arriving at your site? And then the activities you plan at your site, are they all within the CDC standards? And every one of those layers creates a proper precaution to do things a lot differently than we ever have. So I think there's a lot of value as a retreat center to slowly begin implementing those to prepare the staff and to prepare our constituents of what the future might look like for the next 12 months before we really have herd immunity. So I would encourage thinking about that. You know, and if you do any type of child care, you're already in phase 1B and you can get a vaccination now, depending on your state and your county and your community. So, and we want to use that just as an additional layer, not that we're going to change any of our behaviors for a small retreat. I mean, we had a 5-person retreat that was all outdoors 2 weeks ago, and it was freezing, but they had a wonderful experience. And one of our constituents told me on the phone last night it was the best retreat he's been to. And this is the 5th year we've done this retreat. But we did it all outside, except when they went inside to be served their food, and a lot of them ate outside. and they were all in separate bedrooms and were never in a space indoors together for longer than 15 minutes ever. So I felt very, very comfortable about that retreat. I'm very interested to hear the idea about what happens after they leave and encouraging them of their behaviors and what they do. And some of them were very, very precautious prior to even coming and wanted to make sure that we were providing them lodging and environment. Because I think two of them said, we never, ever, ever are with anybody inside, period, without a mask on. My family hasn't been anywhere in 9 months, you know. So those type of things, it becomes so much more of a detailed planning for us, even to have a retreat for 5 people. And that's kind of it's a paradigm shift for us that I think we have a responsibility to begin training our staff and preparing for people gathering safely together in small groups. So sorry, that's more of a statement. I'm not an expert in any of this, but I just wanted to share with you that I do. And now I'm not a risk averse person. I'm a risk taker. So I know that about myself, but we have a staff that helps keep everybody in check and a board. But anyway, I just wanted to share those thoughts with you, Marguerite, kind of from another viewpoint of how everything that Anna has shared with us, there are other layers that we can add on top. And we would like to use the fact of vaccination to encourage people to get outside, right? And to get out of their house and come be in nature and do some things with us, but we're not gonna ever try to expand it more than the capacity that will be safe until we have herd immunity. So, but that's a mindset that we have to change. Everything from our board of directors to our guests.
Thanks, Tom. I appreciate that.
Me too. And I just want to say that that's right where I'm at also when we have people coming into the garden, and it is true that, you know, there's so many things that it's a lot of work, a lot of effort, a lot of precaution, a lot of communication, record keeping, you know, so that we know who's there and what they've been up to beforehand. And but it's absolutely possible. And I appreciate, I feel like sometimes in the realm of caution and representing that that which science tells us and that which we don't know, I think there is still a lot of room to play within what is possible. So I really appreciate you sharing that experience and that perspective. So thank you. And I hope that I'm not coming across as a wet blanket on what's possible, because I think that there truly is a lot that is possible, but it's just around, you know, how do we move through spaces and stay outdoors and keep ourselves separated to an extent.
I think likewise, we at one point moved back into having smaller groups in the house. We limited it to a max of 13 because that's the number of bathrooms we had. You know, so we kind of did it that way. We have buffet, but that's all plexiglassed off, and you can point at what you want and pick up your plate at the end. People sitting at their own tables in the dining room, and masked and distanced in the conference room. Now, I have been monitoring I'm in upstate New York, so I've been monitoring the infection rate. And we can monitor it by region, by county, and there's 7-day rolling and whatnot. So when the infection rate started and it hit 4%, I was like, that's it. Okay, we're back to all virtual. Well, we've now come down and we've dipped down below the 4%, and I'm considering bringing folks back in again under those restrictions. And kind of like you're saying, the precaution. The hard part is to say, okay, we kind of with infectious disease nurse, we're saying, okay, 4% seems to be, given our area, reasonable risk. If people are willing to take the risk, they know what precautions we're taking. Is that, you know, so that's just kind of where we're at. I guess it's not a question as much as watching what's happening in the area and saying, okay, with windows open, with air purifiers in the house, it seems to be a reasonable time to try again with smaller groups.
Yeah, I appreciate that. I mean, I've been working in the clinic for like this whole time, really, and we come together on teams, and now most of us are partially immunized, but we wear masks, we're distanced, and we have, you know, air purifiers and windows open, and we're limiting the time where we're in a small room with a patient, you know, to less than 15 minutes, and it feels totally, completely safe. And so I think, you know, I think everything that you're describing, like responding to the intensely local data and following what the local public health authorities are recommending, you know, that really is really helpful guidance. And I think that there's a lot more that, as we understand how immunizations and testing can be used, will give us even more freedom within that space. Yeah, thanks. I deeply appreciate hearing people's perspective.
Justine and I have been trying to decide if we wanted to move into small groups here and if that would be helpful, or if we want to stay here in this larger conversation. I was thinking we could maybe put it to the group and see if people would really like to go into small groups, but Justine and I are leaning towards leaving that off and just staying here and continuing to have this conversation that seems to be moving well. Okay. Okay, thank you.
I would just like to comment on the emotional strength of the 5 people that came here. Julie just reminded me that there was more than one person that said, I really needed this, right? Even though it was only 5 people, that they're all having different impacts, and what we can do for others coming together, even if they're small groups, is pretty powerful. And I will tell you, I don't care what my return numbers were for that retreat, right? I mean, sometimes it's just got to be more about the overall impact that it has on the people that are here. Now, granted, we all have a bottom line and we all have to keep our lights on, but it's not something that we're even focusing on right now. It's how can we slowly begin to help people heal. So we're calling this 2021 the year of hope and healing, right? And if we can heal one individual, one family that comes for a weekend, then great.
Tom, thank you for adding that. I think part of the layers for us is that now it's not only just that they're in this physical space, it's the leading up to it. So we just trust them that they've been isolating on their own, or do we ask for proof, right? I think that was one of the questions from the 19th. And then afterwards, you know, usually we're like, oh, we'll miss you, take some oatmeal. But now do we have to do any form of contact tracing or following up? So it kind of elongates our relationship. And I think a lot of it is built on trust and relationship building too. But I see this like very now dynamic and layered response, not just they're here enjoying our beautiful spaces and getting that time to rest. It's much longer too.
I have a question regarding gathering groups of children, you know, particularly younger children, and I'll make it specific. We generally have summer camps. And, you know, so we're at a point where we're going to have to make a decision, do we or don't we? One of the factors in that is we obviously participate in the summer food program sponsored by the state. And they're encouraging people, as many as possible, to, you know, do their programs, because obviously there's a concern about meals for children. And I know children will not be vaccinated. You know, obviously my hope is staff would be vaccinated. Could probably be outdoors, but then should there be, I mean, what kind of precautions or what kind of caution?
You know, in the garden, actually, the most we've been doing, honestly, has been programs with kids. We've been having in kids, in my experience, and I have 2 young children, they're back in school and they're in their little pods of no more than 12 kids. And so they're taking all those precautions. They're really much better at mask wearing than adults. So, and it's so essential for kids to be getting together with each other. And so I think it's really important to be thinking about it. There's probably good guidelines locally as far as how to bring kids together in summer groups and summer camps, and certainly Marin County locally has been focused on how to do that safely. I think one of the questions would be overnight and how to do that and what sort of space. But if it's during the day, I think and largely outdoors, and that the counselors can be tested and hopefully immunized, that I would say that sounds awesome. I think one of the things is thinking about how big the size of groups are, but I mean, I think as we're learning a lot with schools and how we're safely opening schools, and of course there are lots of caveats to that with the teachers and that certainly apply to the staff members. But if with testing, regular testing, and hopefully immunizations, I think you could do that quite safely.
Jane, we do 6 weeks of summer camp, and we've completely reorganized our bedding, and the ACA guidelines, even if you're not an ACA members, are free right now. And their stuff is spot on. There were over 3,000 summer camps that opened this past summer, and only about 5 had major problems, and they were not following all of the NPIs, the non-pharmaceutical interventions, and we're going for it. It's going to be a lot different. It's all small group cohorts of 7 kids and 1 counselor in what we normally try to put 14 to 16 kids and counselors in. So and we reduce it to only 4 days. And the other thing to think about is emotional impact of the entire family. So what we've done is we've said, okay, we're going to offer you a family retreat. Bring your family at first, get the kids used to being back here again, and then parents, you can go on and come back and pick up your kid on Thursday. So they could come on Thursday night or Friday morning as a family in a cabin, and then they can transition away, because let's face it, those what we call explorers, first graders to third graders, are I've heard from more than one parent of how many of them are sleepwalking at night, and their just schedule and their emotions are really impacted, and a lot of pediatricians are saying the same thing. So getting those kids together is really important, and it can be done safely, but you got to put it all in place. And there's some great free stuff out there. I just want to encourage you that there's a lot of statistics that if people did it really safely last summer, and kids, it's proven they don't care about wearing a mask or being 6 feet apart if they're outdoors having fun.
Mm-hmm. Yeah, that's certainly been our experience, is that the impact of being able to be together and just playing, and they really do seem relatively oblivious to mask wearing.
This might be off the path a little, but in terms of testing, if somebody's saying, well, I've been tested, how long, like if I was in contact possibly with somebody, how many days do you have to wait before testing in order for that test to be valid enough? And particularly in the area of the asymptomatic, it's like, well, I don't have any symptoms, so I should be fine. So it's been 10 days, and I'm like, yeah, but I think you still want to be tested. And this is in terms of staff.
Yeah, I think that is a really important consideration for staff. So So what the CDC currently recommends is that if you've had a significant exposure, you've been in close contact with someone, you've been around them for, either had direct contact or been in a shared space with them, or longer than 15 minutes within 6 feet, these sort of significant considerate or exposures, then you have to wait at least 5 days before getting tested to know that you have it's had enough time to incubate and then be replicating and expressed. So but then even after that, because that's like the you have to wait at least that long, the guidelines for quarantine suggest that you should still be quarantining another 7 days if it's a significant exposure. So like the CDC is recommending a 14 without a test, a 14-day quarantine period if it's been a significant exposure. There are some now recommendations that we could shorten it to a 10-day so that we can return to work, but that's really with a test. So I hope that helps.
Thanks.
We have spent a lot of time with Virginia Department of Health establishing the guidelines for letting us over overnight summer camps this summer. And I think they're sticking with 14 days, at least in the Commonwealth of Virginia. But the other option outside of the 14 days that they're willing to do is 7 days of screening with a test. So if you only have 7 days, you have to have had a test within right at the beginning of that 7-day period, and then we could let that guest come here. Does that sound about right to you, Dr. O'Malley?
Yeah, so basically, so that would essentially be a 12-day period from the exposure, right? Because you have to wait the 5 days to have the test, and then that test is the starting point of the permissible 7 days. So yeah, that sounds right on. And I think someone mentioned contact tracing, and what's, I think it was you, Justine, what's our responsibility to follow up and find out how people are doing? I think really it is about trust and relationship, and just letting people know that our way of holding each other in this time of like how important it is for us to be able to come together, but that the ability to come together is completely dependent on our ability to trust each other. And so that part of that is to communicate back if you get sick when you return home. And how do we enforce that? I don't think that we want to be getting into the policing business and introduce that into our relationship, but just really hoping that people will communicate back to us. And then it is our responsibility, of course, to keep really accurate records of who was there, and then and let people know that if someone does get sick, that we have a responsibility to our local public health departments to let them know that this happened, and then they can do the contact tracing.
Well, I really appreciate you bringing up the follow-up piece, Justine and Dr. O'Malley, because that's not something we're normally used to doing. And I've already got my template ready to send out, right? Because we do a follow-up of, hey, give us a little feedback on how the weekend went, what would you do different, and all that stuff. So we've already sent that, but now I'm thinking, well, let me just check on everybody. Let's just send a little note that kind of ends with, oh, by the way, if you've had any symptoms or exposures or any issues, please let us know, so we can also let others know, right? So I hadn't kind of put all of that together until today, so I do appreciate that very much.
I'm curious how people are languaging the lead up to being together. And I do think that the more it's kind of like we're all sort of in training around what is our new way of being with each other, and what are the next 12 months going to look like, and who knows, maybe beyond, we just really don't know. And I think that the more we're putting it into this frame of weaving a supportive container for each other. And this is just how we do it. I'm curious how you guys are languaging that, or if that's something that goes out into the pre-materials, if anyone has any best practices or experience with that they want to share.
At our place, and I hate to say this because I know it's going to jinx me, but with being open since last June, and we've continued to work with our groups before they come, and I can honestly say I have followed up with every group and have not had a single case of COVID that has happened on a retreat here. And now it will, but because I said it. Can you stop taping this, Ben, and take that out, and just so I don't have to come back to it? But you know, and this is probably one of our first weekends where we have one group leaving today and another group coming tonight, where most of the time we've had a little bit of a gap, but you know, it's, you know, we had one group say, well, we don't think we need to wear masks. I said, that's non-negotiable. You're not coming. You know, and just being very sad about our ways and that. So having a form filled out about, have you had any symptoms? Have you been in contact with somebody? That has to be filled out and signed before they come. And like I said, and following up behind them. And we've been doing okay. And we're not in a nice warm place. I mean, it's like 0 degrees today here. So we're not outside, that's for darn sure. But you know, it's working somehow. We have good ventilation in our building, so I don't know.
How big are the groups that you're in?
For some of the time we've been up to 50. Whereas the group that's here right now has about 30. You know, our county is a yellow county. So we actually, based on CDC guidelines, could have groups of 100 in the building without any violations, but that's not what we do. And you cannot social distance in your bedroom from someone else. So we limit it to only as many bedrooms as we have and how many can fit in the rooms. Most of them are a bit smaller, more like 12 to 15 for most of them. So.
Thank you. I'm curious, I see Ben's question about if you're doing anything about testing, if you're asking for negative tests. It sounds like not, it's just, you know, doing the symptom screening in advance. Mm-hmm.
Correct. Yeah. I mean, I would love to have the quick testings, but again, as you stated, they're not always accurate even. I mean, so then you go, oh yeah, everybody come on, you're all fine. And then we find out one is, you know, so, you know, we, you know, kind of have put it on them to make sure that their people are doing what they need to do. And nobody else, I mean, that's the thing. The groups don't want to come and say, oh yeah, we got COVID on our retreat. So they're also being cautious within their own group too.
And I think it's true that, you know, we have our own individual relationship with risk, and I, you know, it's hard. Like I'm so delighted to hear what you just shared, Paul, and to hear that like no one has gotten sick, and that's, you know, just, it's so awesome. And as I was preparing for this, I was looking at some of the data, and like now I just saw in JAMA that they're estimating that as many as 50% of cases of COVID are from asymptomatic transmission. And so that's like where I feel so so stymied. And I know we probably, each and every one of us, have our own like individual level of risk aversion or acceptance. And and a deep, deep desire to bring people together, and just like figuring out how are we responsible to them all. And, again, like mask wearing and distancing and ventilation, it's effective. It really does work. And if we're all wearing, especially like if as we increasingly, hopefully as a society, just get behind like wearing masks all the time, then it just creates safer and safer spaces for us to be together, masked and separated in smallish groups and with ventilation. And so I do feel that a sense of optimism, especially with immunizations and with more and more testing that's coming online, and also just people getting behind mask wearing when we're in shared spaces and outside. Like I think that is also going to just make the risk of bringing people together go down. It's so good to hear people's experience, because we're all just doing this big collective experiment together. So it's so valuable. I know I'm here with my physician hat on, but also, just really, this is like gold for me to hear what other people are doing as they're bringing people together, with my retreat hat on.
Anna, it's almost time, actually. We were unsure how long, if this would be 60 minutes, 75, 90. I have one last question, but Ben, I also saw you unmute yourself. Do you want to speak into anything?
I wanted to lift up what Oren had mentioned in the chat about teenagers, and I don't know if other folks are thinking about teenagers and kind of how teenagers operate and teenagers' risk levels. So I just wanted to lift that up and see if there was room to talk there, but I'm open to your lead too, Justine.
Anna, do you have a quick response about teenagers?
I do, Oren. The Project Avery teenagers have been awesome and totally on it, and mask wearing and having an awesome time. It's a mixed age group, but there are teenagers in the group that have really been completely on it.
As I mentioned in the beginning, this will not be the only time in space. And as Margarita hinted, we'd love to have you back in a couple months to see where we're at then. I also see a couple people may still have lingering questions. Anna, I asked if we could share your contact information for follow-up questions. Is that okay?
Yeah, absolutely.
Wonderful. We've also recorded this session, and I've been taking notes on some of the cross-story sharing. One question I would like to leave with is if the community call felt a bit different. It's a pretty heavy topic. Some of us are questioning the future of our retreat centers. We talked about societal and political equity issues. Could you leave us with one seed of hope? What are you seeing that is giving you hope and may inspire us to continue this?
So many things. I think the immunizations are, give us great reason to be hopeful. But I think more importantly, I feel like we are at a societal inflection point, and that we have great leadership that give us reason to be hopeful that we'll increasingly be coming together around protecting each other. And I have a lot of hope for the people in this space and with these skills. I mean, these really truly are the spaces that we all need to be creating for each other, so that we can be increasingly paying attention to how we can better be loving and supporting each other. And sometimes it comes down to the practical realities of mask wearing and distancing, but on an energetic level, reaching across divides, holding spaces for listening and loving is really what gives me the greatest hope. So yeah, thank you for having me. It's been such a pleasure to be here.
Well, thank you so much. Thank you for the work you continue to do. Thank you for the work you do at Commonweal and spending time with us. Thank you to everyone who made this special community call. Next Tuesday, we'll have our regular scheduled community call on organization transformation. And then we'll keep you all in touch about another community call related to COVID-19 and vaccines. Thank you.
Thank you. Mom.
Thank you.
Thank
Thank you.
you.
Thanks, Justine and Ben. Good stuff.
Yeah, thank you all.
Thank you very much. So helpful.
Thank you, Anna.
Thank you very much.
Thank you.
Thank you, Anna.
Welcome,
Thank you, Ben.
guys.
It's like a family gathering.
It is. I know. I don't want to go. Hey, Deb.
Have another slice of pie.
There was pie.
I will.
I hope that was helpful. I know that like I appreciated Margarita's like just bringing up like caution. You know, it's not like the feel that we really want to be going for, but it's you know, my hope is that as we hold the caution, we allow people to just be able to deep sink into the space.